All right. So thank you, Dr. Crush, for being here. I'm so excited for what you have to share. And
Thank
yeah, we,
you.
we appreciate your time. So thank you.
Yeah, no, thank you so much for having me, ladies. I've been a physical therapist. Oh, wow. How much time has passed? Like 15 years, 13 of which I've been in pelvic floor. And, the interesting thing is, having been a cancer survivor myself, I never thought that there was a relationship between pelvic floor and oncology. And actually, there weren't many continuing education courses outside of PT school, probably up until maybe, oh, I want to say like anywhere between 8 to 8 years ago, where they started offering all of these courses on pelvic floor and how to care for cancer patients and the different kinds of procedures. And even where I work now, there, is a strengthening after breast cancer program.
Okay.
I mean, obviously treatments have evolved and the whole sexuality, like during and even following cancer, became something very important to me, not just as a cancer survivor or a pelvic therapist, but being on the other side as a patient rather than a clinician. I'm like, there's such a lack of knowledge and conversation about sexuality, intimacy. It's almost like we never get asked those questions. Like, how are you in that department? I remember going through chemotherapy-induced menopause and I had no idea what it was. And it was like, oh yeah, that's going to happen too, as a more like after the fact type of thing. So I became pretty passionate about not just my pelvic floor work in relation to oncology patients, but also like sexual health, education, advocacy, because there was a lot I didn't know as a clinician. And having experienced it as, you know, someone who had cancer, who has survived it, really spurred me on to learn more, to get my sex counseling certification, because I wanted to give a safe space for all folks to be able to talk about that aspect of their lives, because it is such a huge quality of life issue. So I'm happy y'all could be here today. I like the fact that it's an informal presentation. I just have very simple slides. And, if at any time someone has questions or wants to share, like, please feel free. I love the open dialogue. And it's a safe space. So I will start sharing my screen unless anyone has like questions about my background. Um, I suppose fun fact about me, I grew up in Hawaii, moved out to the East Coast. Gosh, I've been on the East Coast since 2001, but am currently in Philadelphia. So New York City was my old stomping ground. So it was nice to hear you ladies talking about it. Um, yeah, and my name, Ivalani, means heavenly seabird in Hawaiian. So I
Great.
really, yeah, appreciate the opportunity to, I don't know, help guide people on this journey, because what I'm named after is known as a guide bird in many senses. So, yeah, here, let me start the screen share. Okay, so here to talk about intimacy during and after cancer. So, like I mentioned, sexual health is very important as a quality of life component. And even as a physical therapist, it's something that is very function related, very, gosh, bodily confident, bodily movement related. And when you go through treatments or even coming out of them, you're not just coming out as you're not the same person coming out as you went in. And your body is not either. And trying to navigate the changes in your body as well as, whether you're partnered or not, like what's going to happen to me in that domain. Am I still going to be able to be intimate? I don't have the same libido as before. I feel self-conscious about certain parts of my body, or I'm just so goddamn tired from coming out of treatments. Like that is the last thing on my mind. But sex is a very important part of like our emotional well-being, self-worth, even the relationships, romantic, that we choose to engage in. It's, a part of like the satisfaction from those physical, intimate interactions. So sexual concerns are definitely among the most overlooked issues in women's cancer care. I actually found a statistic that is in the American Society of Clinical Oncology, where compared to men, women with cancer are significantly less likely to be asked about sexual health by their medical providers, where men, are inquired 53% of the time, women only 22%. So really not just the providers knowing, but us to be advocates, to be asking questions, to be pushing for solutions or resolutions so we don't lose that part of ourselves as sexual beings. Now, some of the things we'll talk about and discuss today are just general understanding of the sexual changes that, you know, are resulting from different types of cancer treatments, whether it's surgery, chemo, radiation, hormonal therapy. I know someone had mentioned aromatase inhibitors and how that impacts, bodily function, soft tissue. So identifying like common and physical, emotional, sexual concerns, um, sometimes just talking with someone who's been through it can make you feel less alone, or maybe help to give you a better understanding from their perspective outside what medical professionals have to offer. And sometimes our concerns going into treatment may very well be different coming out of treatment as we try to just get back to living. So there are some like evidence-based interventions and strategies just from a pelvic health therapist standpoint and also like a sex counselor standpoint in supporting sexual health, our recovery, the restoration of intimacy. So similar to when we're going through treatment, we have a team. Well, it goes beyond that in terms of the biopsychosocial model of health. So bio meaning body, the physical changes, impacts, psycho, the psychological, emotional, mental impacts during and post treatment, as well as social, like how we interact with others, like in our social spheres, whether that's work, personal, community, and our desire to engage in those activities during or coming out of treatment. So, first off, cancer treatments such as surgery, chemo, radiation, hormone therapy, like I mentioned, can affect sexual function. So when I'm speaking about cancer, I mean, I'm a breast cancer survivor. One of you also mentioned having been a breast cancer survivor too, but the thing is that these sexual intimacy changes from a lot of these medical interventions can occur in any woman who's experienced any type of cancer. One that had come to mind for me and with some of the clients I work with, one would be, pancreatic cancer, colorectal cancer, even head and neck cancer, because that can change like very vital bodily functions, physical image. um, which then can impact our confidence with other people, our confidence in the bedroom, our comfortability with our own bodies and our own bodies in relation to others. So things like sensation, scar tissue, you know, even if the scar tissue heals perfectly, versus maybe someone who's had a more challenging road or had to have more surgeries, more scar tissue, which sometimes can, nerve damage can come hand in hand. So decreased sensation in those bodily areas are just a few things I can think of that would impact your sexual function because if you don't feel good in your own body, how are you able to feel good just with someone else, seeing you and being with you in those like very vulnerable moments? Um, Chemotherapy, as we know, the fatigue, the nausea, there can be chemotherapy-induced menopause, hormonal shifts, things that can also result from chemotherapy, and I'll talk about this, is something called the genitourinary symptoms of menopause, which can include things like vaginal dryness, recurrent yeast infections, bacterial vaginosis, urinary tract infections, reduced libido, fatigue. Sometimes there are cognitive changes due to the chemotherapy in conjunction with the menopausal changes that can impact your desire to engage in physically intimate acts with someone else, or even be able to participate in the act itself. Because something such as, vaginal dryness, also the medical term vaginal atrophy, with the weakening of the muscles that can not just impact sexual activity, but also continence, because the muscles do weaken from the treatments and just from, the lack or the decrease in physical activity that we have. And, I find across clients that continence issues can also impact sexual function, desire to have sex, confidence. Radiation, you know, can cause like sclerosis of the tissues or hardening or a reduction in elasticity or pliability, which, can happen on the skin, tendons, ligaments, sometimes bony joints. So, and that can make intimacy physically tough, especially if you like variety in the bedroom, then that limits you to certain positions that maybe if you had enjoyed them before, those aren't an option. So where do you go from there? Hormone therapy, now, like the aromatase inhibitors, because they are suppressing the ability of your body to create estrogen. In some instances, testosterone can further exacerbate the vaginal dryness, those weakening of the pelvic muscles, incontinence, the drop in your libido, maybe even resulting in painful intercourse, mood changes, like I mentioned, with menopause, whether it's, chemotherapy induced or, depending on the surgery, if a hysterectomy had to be performed, that can also impact our hormonal levels. And, the hot flashes, night sweats, fatigue. I mean, who feels sexy when that type of stuff is happening? Um, does anyone have any questions so far as I move
I'm
along?
curious just because
Yeah.
I'm like, I get to stop the aromatase inhibitors at the in like October.
Uh-huh.
Um, and so like I guess I always and how like what's the like do you have any knowledge on like the reverse effect of some of that? Like when you get off of it, like does it start to build back up or is it like you're just really like that line that's really thin now, so you're kind of screwed?
no, I would never say someone's screwed as a pelvic therapist, and I think more doctors now than even a decade ago realize, oh, there's pelvic physical therapy that can help with a lot of those tissue changes, other physical changes with fitness, and even being able to like implement like counseling or therapy. Now, are you referring to like vaginal tissue thinning or
Yeah,
dry?
yeah. Like, can it
Yeah.
rebuild itself? That's a strange question. I realize
Oh
that.
yeah, heck
I
yeah.
don't know if that's
No.
even really the right question.
Yeah, yeah. No, it's definitely part of the healing process, much like anything else coming out of like major medical procedures or trauma. I mean, the act of even rebuilding the muscles through whether targeted pelvic floor exercises, okay, or even things like dilator therapy to help restore the elasticity of the muscles for the purpose of penetrative intercourse. There's topicals. I mean, traditionally, there's the more like hormonal, like, oh, estrogen suppositories,
Mhm.
topical estrogen clean, like creams such as estradiol. Often there are like very specific pelvic pain doctors that if you're allowed to use hormones, even topically, will add like a little bit of testosterone to boost vaginal tissue resilience because there are testosterone receptors on our vulvovaginal area. But then there's also like natural or non-hormonal remedies that I've come across like through the years where hyaluronic acid helps vaginal tissues like resorb more moisture or water. So the tissue thickness builds up and it's able to withstand like more pressure, more friction, more shear, all of which happen with sex. And, there's aloe, which helps with tissue healing. And even things like, as long as you're not allergic, like coconut oil. So those type of products they're definitely out there. So it's not like it's lost forever. It just takes time to build it back up, depending on any medical restrictions. Does that help
Mhm.
answer your
Yeah,
question?
yeah.
Yeah, yeah,
I had a question too. Do you
yeah.
have any experience with how effective is something like a red light therapy?
Ooh, that's a good question. Before red light therapy became a big thing, I actually used to use red light therapy for patients that had like chronic pelvic tightness and pelvic pain. I've also actually seen it used in skin cancer, and what it does is it enhances the development of little capillaries, which can then bring more oxygen and blood supply and more of those healing cells to help repair the tissues. So, I mean, I have heard and worked with clients like using that modality where it can be helpful. I mean, but there's so many different ones out there, you know, which ones are actually legitimate,
Mm,
which ones like are, the right wavelength or light frequency to actually promote tissue healing. Um, I can definitely give more information on that. And, there is a wand, a red light therapy wand.
yeah, it's
Where,
in my algorithm for sure.
yeah, probably because I'm talking about it, I'll get like all these like feeds and ads about
Right.
red light intravaginal wands. But yeah, and they're safe. They're not even supposed to be hot or warm. And that's, they can be used on any part of the body, but there are like pelvic therapists who do that, but insurance doesn't cover it. And some of it can be really expensive. I think that wand I'm talking about was like $700,
Thank,
something crazy. So it
yeah.
makes it less accessible, but it is an option for
Yeah.
sure
Thank you.
to help with. Yeah, of course. Um, any other questions?
On to like what Ashley was saying about like when you
Mhm.
stop the aromatase inhibitor, and I'm not
Yeah.
sure if this is what you meant, Ashley, but will it naturally without I joke around with the coconut oil without making a fruit salad there. Are we going to be able to just like naturally have estrogen come back into our bodies when we stop the
I'm going
aromatase
to
inhibitor?
call it making a fruit salad now. Every time I'm going to think that. So thank you.
I never heard that, but
I love it.
love it.
Because don't we laugh? Like, can you imagine telling any man that had any issues like this, like, you should try coconut oil or this oil or that, and like only women, right? Coconut oil.
I know.
I've heard
I'm
this so
like
many times. So
popping
yeah,
in like a suppository and then like, like I
Yeah,
got the estrogen
yeah,
suppository and then I alternate with the hyaluronic suppository and
right.
I'm just like, pop
Yeah,
it all in there.
exactly. Right. One more thing in there,
yeah.
it's a fruit salad. So that's why I
I'm
always
recording
refer
this.
to
This is lovely.
That's one of the downsides
so.
of having your your anatomy more internal than
Mhm.
external. It's like one of the few ways that our bodies are able to absorb this medicine. Oh, I forgot to even mention like CBD and THC suppositories can also be helpful for pelvic muscle spasm and pain. But back to the aromatase therapy, you know, I feel like depending on your age and if you've already gone through menopause or, have or have not had a total hysterectomy where the ovaries are removed, um, it can come back or be reversed, as my oncologist said. However, if, see, that's like a pretty tricky one. I mean, I feel like if you're like past menopausal age or have actually had ovaries removed, it's diminished, it's gone. But you know, I can look into if there are any research, especially newer research out there that has actually found that estrogen can return into the body. But yeah, I think menopause would be like if you are already postmenopausal, that would be the only caveat for it.
Yeah. So I can speak to that because
Oh,
I
okay,
don't
no,
take
great. I
anything
love this.
anymore.
Yeah.
Because I don't take anything anymore. Now, I did have my ovaries removed.
Okay.
And I still use vaginal estrogen. It
Mhm.
still was just a little not as awesome as it could be. I'll just put it that
Yeah.
way. So I'll do the fruit salad. But I mean, but that being said, I mean, it's
You're
probably
welcome.
everybody's different, right?
Yeah.
Probably. Yeah, but for me, I still use the vaginal estrogen.
Yeah.
And that other stuff from Hello Playground that Ashley got me onto. The
Oh, I'm
Miracle
not
Melts.
familiar with that one.
Oh, good.
Those are good.
Yeah.
Ashley's to blame for that one.
To thank you, man.
Yep.
Jen, do you have to use them every day, or is it just like 2-3 times a week for the estrogen?
2 times a week. So I'm just maintenance. And like when I
Mhm.
first started, I mean, it's been a while. I it's been a I've been on it for a while now. Like when I first started, it was like I think 2 weeks of every day. They say that kind of helps try to build things back up.
Mhm.
I am not a doctor. And then it's just twice a week. And I'll say I don't always use it twice a week. Sometimes for a while, I was just using it once a week. So I kind of have experimented on like
Mhm.
how much, like, can I do it like this or can I do it like this? So I just kind of experiment, but usually twice a week.
Because I'm also using them, and I never did the 2 weeks, and my doctor was adamant, like, you cannot do it for 2 weeks. He was concerned with bleeding
Really?
too much. I know
Oh,
everybody else said it could
Huh.
be every day for 2 weeks, but my doctor said
Yeah.
yeah.
no, and I repeatedly asked because people kept saying it. So I've only ever done it twice a week, and I think I'm on like month 3 of doing this twice a week. But
The because it was originally my oncology team who prescribed it for me, and that's how they prescribed it to me, because how it was told to me was that you needed that 2 weeks to kind of help kind of build things back up and then you could do the maintenance. Anyway, that's what I was told. I mean,
That's what I
anyone
read
I've ever,
everywhere too. Yeah.
yeah,
No,
yeah.
clinically, that is correct from my clients who do, whether they take estrogen suppositories or topical estrogen. It does need time to build up in your system, but once those tissues start building, it's almost like you have a platform to rebuild a bit easier, hence like that maintenance phase. I even have some patients who just use it as needed, like say they're not sexually active or they don't have as much vaginal dryness and they just use it as needed, like when they feel like, oh, something doesn't feel right down there, or, maybe I'm going to be engaging in more penetrative sex, so I better, really keep on the maintenance.
And then just a plug for Melissa because she also makes a CBD suppository that's pretty
Yeah.
great too.
Hi,
So
hi. Yeah, check out Upstate Mary. We use full spectrum CBD, and then we also, if you're in New York, we launched a THC infused lube that you can only get through dispensaries. That's a lot of fun.
Mm,
Yeah.
oh.
yeah. Yeah.
I was going to add something. I got suckered into. For me, it was like I had terrible plantar fasciitis pain, and I also have thinning vocal folds after having my
Mm,
thyroid removed. But I've been in full menopause since age 36. I had my ovaries removed,
mhm.
and I'm now. I just got suckered into this supplement. I'm like desperate, and it's like I'm wondering if this approach, like nutritionally from the building from the inside out, is it possible with the right type of like collagen, hyaluronic acid? Like it's got some other ashwagandha, some other things in there. Like just
Mhm.
mainly though, I'm wondering about collagen. If I eat enough collagen, can that help me in my vaginal health and my other tissues in my body? I don't know.
Hmm. Well, I know there's research for collagen with joints, but here, let me take a quick look.
It would be wonderful if it's I'm like just hitting it from as many angles as possible. And
No, I really
yeah,
love like non-pharmacological or things like supplements. Like I
yeah.
definitely took a whole host of mushrooms like while I was in chemotherapy-induced menopause to help manage the symptoms because I didn't want it was just really uncomfortable to go
Yeah.
through and it was making me crazy. So, I mean, anything
And
that
I
could
and
have
I
helped,
went,
even phytoestrogens like flaxseed,
yeah.
or like soy, things like that, to supplement your system with like estrogen to heal.
I was diagnosed in 2014, and so I went like it was 10 years, and then suddenly
Mhm.
this menopause conversation started shifting, and
Yeah.
10 years into it, then I was like, oh, maybe you could take some estradiol. And I'll tell you, that has changed my life because I was one of
Yeah.
these people having the genital urinary
Yeah.
constant like what we thought was UTI, and it was just my vaginal tissues were starved of estrogen as soon as
Mhm.
I started taking. It's almost like I don't even think about it. I don't have a schedule. I just start to feel a little more irritation and give myself a little
Mhm.
microdose of estradiol, and it soothes everything, you know. It's kind of been amazing.
Yeah.
Do you use the tablets? Not the
I
little
wish they gave me a
suppositories?
neat little suppository. They gave me this like gross little like syringe that I have to wash and reuse. It's not
Yeah.
very
Well,
like
you could buy
user
Oh,
those by
friendly. Yeah.
like the 100 pack on Amazon because I was using that when I was doing the coconut oil because I was like maybe
mhm.
that'll help, but it wasn't
Yeah.
helping me. So
Yeah.
yeah.
No, a lot of times those suppositories, if they're not already in a tube with an applicator, I mean, they're kind of tough to use, especially if you already have vaginal pain or it's just Premarin is the biggest one I can think of where it's just really sticky and tacky, and some people feel really uncomfortable that the estrogen comes from horses. So oftentimes these suppositories are compounded with coconut oil for easier use and more comfortability. But I did find something on the collagen because during menopause, all of our tissues can change even in our skin. It can get drier, more saggy, and similar to the hyaluronic acid, how it affects the vaginal tissue, the collagen can do the same. It doesn't, I haven't found anything about a specific dose, but there is an
I know there's
opportunity
different
for
types, and
remodeling.
some are
Yeah.
more like bioavailable, right? Your body can absorb
Yes.
them better, and yeah.
Yeah, for sure. For sure. Um, and sometimes you may need another like supplement similar to like calcium and vitamin D to kind of boost your body's
Mhm.
absorption. So, no, I like this discussion. Let's see. Any other questions about vaginal tissue healing or estrogen? Like that. Okay. Now, I did talk about physical, emotional, social, relational aspects for that biopsychosocial model. Something I did want to point out are, aside from the scars, I didn't mention anything about lymphedema and how that can affect like physical image, but also movement wise, comfortability wise. And especially if you are like coupled, I've found that individuals that have with their partner more communication and support tend to do better because there's this back and forth dialogue about what's comfortable, what's not, what do you need, what can I give you, being able to advocate for what you need and have your partner listen and respect those boundaries. That's a huge support for the healing process, especially if you're not in a mentally or emotionally good place or you're trying to build yourself back up to that place. Okay, we did talk about the vaginal dryness and GSM, which is the genitourinary symptoms of menopause, libido, sensation, the body image, anxiety, pain, and fatigue. So this is just a little chart about the intimacy cycle, the stages of sexual like arousal, starting from like initiation to arousal itself, which then can contribute to desire, then orgasm. And, physical intimacy can make us feel much closer to our partners, even if it's something like intentional touch or kissing. It doesn't necessarily have to be penetrative sex itself. And, even apart from cancer, as we age, some of those desires we have or, things that create arousal within us or, our boldness with initiating intimacy, that can change over time just due to age. But there are strategies. We did talk about red light therapy, topicals, hormonal or non-hormonal, and then if the genitourinary symptoms of menopause, and I'm specifically thinking about urinary leakage, being able to talk to your gynecologist, more specifically a urogynecologist, would be a medical referral source for managing those symptoms. I mean, in some extreme cases, with the weakening of the tissues, even things like prolapse. Pelvic floor physical therapy, as I mentioned, can be really helpful in addressing things like strength, soft tissue, elasticity, vaginal skin care, even something as simple as like your hydration habits can affect vaginal tissue resilience. And also depending on, how active you were during your treatments or not because of the medical agents used during your treatment, or maybe even surgery or radiation. There can be weakening in many different areas, not just within the pelvic floor. But if we think about colorectal cancer, a lot of hip weakness, core weakness. Breast cancer, a lot of shoulder issues, range of motion, sometimes early onset arthritis or frozen shoulder. That rehabilitation can be done. In my sex counseling career, there's a lot of talk about mindfulness practices or something called sensate focus, where you use your different senses to tap into those systems of arousal, desire, safety, pleasure. So something like music that makes you feel good, even soft, smooth sheets, or, a piece of clothing that feels good on your body. For some people, it's smell. Others it's touch, like a light touch can be very more stimulating versus something heavier handed. But overall, the way that I practice and I feel like gives the best, most rounded care is something that takes the whole body into consideration, holistic, if you will. Let's see. I did talk about, sex is not just penetrative intercourse. It can be other means of physical affection. Some people define sex differently. Some people think of sex that can be partner or solo. Some people feel that intimacy is more related to the deeper connection you have with your partner, the amount of physical affection expressed, or maybe, the way your partner or can anticipate, your needs and be proactive about it. Kissing, cuddling, there's even something called outer course, also known as dry humping. Those are all available options. So sometimes I have clients, if they have a lot of pain, I'll say why don't we start from first base and kind of build up from there as your pain, as your symptoms are worked on, as you start to feel more embodied in yourself. Anybody have questions? Okay. Okay. I did mention communication with partner, not just medical providers, but partner, because oftentimes if you're not ready for intercourse or not in the mood, maybe, you're still healing or in pain, sometimes just communicating what you need, no matter how small. First example is, feeling close, maybe you want to be hugged more, or be physically closer in proximity to someone. Or even if you are engaging in intimate touch, checking in, what's good? What would you like? Slowing down is also important to ensure that the muscles don't react excessively if pain is provoked or does come on. Let's see. I did talk a bit about pelvic floor PT and how it can be helpful with pain, strengthening the muscles, educating about different modalities. We did mention red light therapy, topical or internal hormonal therapy, or maybe non-hormonal. I did talk about rehab for other tissues, whether it's scar mobility, muscle strengthening, even management of lymphedema. The dilator therapy, I'm not sure if any of you are familiar or had been recommended something like that during your course of care or healing process.
Yeah, my doctor recently recommended that, but I haven't actually explored that yet.
Okay. Um,
I've used them.
yeah.
Yep.
Are you
I've
open to
had
sharing?
I've had therapy twice. Pelvic floor
Okay.
therapy twice. Yep. Yep. And I've used it both times. It was very helpful.
Yeah. And, you know, there are even instances where if radiation is done to the pelvis, whether externally or internally, like dilator therapy is something that is maintained over time to ensure sexual function and tissue elasticity. Um, are there any questions at this point? Cool. All right. Seem to have already discussed this.
One thing I was going to ask, I mean, are there
Yeah.
any, for anybody that might listen to this later, are there like any like quick tips of like relaxation methods for down there, or like little
Mm,
things you might do that would be like if ideally somebody could go see a pelvic floor PT. We know that that's not as common. Like I think we have like two here in St. Louis, maybe total. So it's not like a
I know.
super
It's like,
like
first,
well-known practice yet. But are there just like at home, like maybe like easy, quick tips that you could just a couple of them that you might be able to share?
oh, yeah. So even something like yoga, for instance, to help with muscle relaxation and flexibility. There are a lot of actually clients that, even if they don't have pelvic pain or haven't gone through cancer treatments, that I'll give specific poses or postures for because it helps to relax the pelvic floor when you sync them with like diaphragmatic or deep breathing, things like child's pose, happy baby. Some people, it's the supine pigeon pose where the ankle is crossed over the opposite knee, um, or even like cat cow. Some people, even just lying in what is referred to as like a bound angle or butterfly pose that's supported with your lying back, you know, anything that like those positions to help down regulate or calm your nervous system. No, I've also had some clients who will do perineal massage, you know, on the outside at the base of the vaginal canal to help relax the tissues. Some clients I also teach how to do that internally to just give gentle stretching to their pelvic floor without a dilator. Um, and interestingly, you guys mentioned CBD and THC suppositories. The vaginal tissues and canal are rife with endocannabinoid receptors. The rectum, more THC receptors, but things like that can be helpful and relaxing. And, also things like magnesium supplements, which actually are, recommended to women with really painful periods or a lot of pelvic abdominal cramping. That's something that's also helpful. Warm soaks or baths. Um, Let me see.
I have another question. I'm just
Yeah, sure.
from your perspective, are there certain toys that maybe do more harm than good in terms of, so because we're talking about relaxing the body and opening and stretching. And
Yes.
so I think a lot of toys are clenching, you're having orgasm, very stimulating.
Yes.
So just do
Can
you have
be.
any thoughts on that from your clinical perspective?
Yes.
Yeah.
So I can't believe I forgot about toys. Where is my mind at? No. So from a physiological perspective, vibration actually helps to relax muscle tissues. So I often find that toys, they don't have to be internally used, but in some cases, those are really beneficial that will vibrate. to help keep the muscles relaxed, you
I
know.
really love those little like the little puffs of air stimulators. Those are
Yeah,
very
yeah,
nice.
like those like little clitoral like ones,
Mm.
like gentle like suction, sometimes like air or maybe like a little bit of pressure. Um, but even vibration on the outside to the clitoral area. I mean, that area has so many nerve endings. So even it doesn't have to be like heavy vibration, even something very light is helpful. Now, with things that maybe are not a good idea or not safe, um, obviously toys that are bigger than the dilator you're able to use for treatment, you know, rough, fast movements, especially if the vaginal tissues are not very resilient, can result in pain, sometimes like injury. Um, there's there's also some individuals that rather than vaginal penetration will start utilizing rectal penetration if that area feels better. Um, yeah.
Thank you. That's helpful. Yeah, I think it's
Yeah,
like a
sure.
starting point for people. And I think like we as women do a big disservice to ourselves when we're trying to compare ourselves to this earlier, younger version, and
I know.
we can't do the same thing anymore. We're not take the same approach, and
Yeah, or I don't orgasm the same way that I used to, or maybe you need more, or maybe it's a different area that needs to be stimulated. Um,
yeah,
there's a connection between the areolar or nipple tissues with female genital arousal. Um, it's also used to help induce labor, so there is like a connection, like an erogenous zone there as well. Um, and even there's people who like they start getting more into like actual like sexual play, like role playing, BDSM, um, other types of kinks that maybe could be explored that would help.
thank you.
You're welcome. Does anybody have any other questions as I kind of wrap up here? That's pretty much it.
I guess I
So,
have one question.
yes.
Um, what do you find is kind of the biggest barrier for clinicians to be actually recommending pelvic floor therapy? Because,
Hmm.
like, for my case, I had my ovaries removed and started having problems soon after that. And I had a gynecologic oncologist who was the one who took my ovaries out and basically acted like he'd never heard of anyone having the kind of pain I was having after my ovaries were removed. And it was actually because the group I was with, I knew enough to say, do you think I should go to pelvic floor therapy? And he goes, well, I guess you can if you want. Kind of just like, eh. And I get to pelvic floor therapy, and they're like, oh my gosh, yes, 100%. This happens all the time when ovaries are removed or this or this. So, like,
Yeah.
how, like, what's the barrier to get these clinicians to actually acknowledge that something that they do actually can cause problems? And I'm not
Yes.
blaming him because I needed them out.
Yes.
So, not throwing shade at you, but to just acknowledge that, yes, this can happen and this is what we'll do if it happens.
Yeah, really, it boils down to, and I've just seen this through my pelvic floor career, lack of knowledge or awareness, even within the medical community about pelvic floor therapy, what it is, what it can do. I've even met some obstetricians and gynecologists who were like, I've never heard of pelvic therapy before. What is that? Is that something my clients could use? So it's just, and they're not, she mentioned that they weren't even educated or trained on it in medical school to even think like, oh, someone could use postpartum care. Oh, you have a C-section? That's major abdominal surgery, or depending on the method of getting the hysterectomy, like that can affect your body in different ways. I mean, also from the medical system, it takes a really patriarchal standpoint, because you can bet if a guy's testicles had been removed, they'd be recommending testosterone therapy. They'd have a whole litany of options. And I'm just feeling like there's a lot of like ignorance or lack of curiosity in the medical community. So therapists in my profession, we spend a lot of time just like educating these providers on like, hey, we're here. We could actually help with XYZ. Even where I worked at Penn Medicine, you know, I mean, they have a great oncology program, but only a year ago, they were like, oh, we should maybe talk to pelvic floor therapists about, sex and cancer. Because, no, why would someone who has cancer like desire or want to have sex? It's not even something that's on the table. Like, as young as I was when I had cancer, like I had to bring it up to my doctor.
My doctor tapped me on the shoulder and was like, "Oh, you're not going to have the energy for that." Like that was the conversation around sexual health.
Yeah, and that strains a lot of relationships, and it makes you wonder about those statistics where, geez, why are, divorce rates, or dissolution of relationships higher amongst like women who have cancer versus men who have
I,
cancer?
I have a question. I know we're just about out
Yeah.
of time, so if there's not time for this, or then maybe I can ask Jen later. But like, if you go to if you sign up for pelvic floor
Mhm.
therapy, and this might be just a bigger question than we have time for, but
Mhm.
what would you expect? Like, what does that appointment look like? And I know like it covers a lot of approaches, but what do you expect for that? I've never gone
Mhm.
for that, but now of course I'm intrigued if that could work, especially after what Jennifer said.
Yeah. No, so I can tell you what it generally entails. I mean, similar to, you've been to physical therapy before, correct? So, I mean, they do an initial assessment, but often the intake is more in depth. Like we're asking questions about function that people normally don't ask. Like we have conversations about your bladder function, bowel, childbearing history, you know, diet and hydration habits. And a lot of what we do that first session is it's like a lot of education. Sometimes I'm spending time explaining this is the pelvic floor, these are the muscles. Oh, this could be why you have symptoms. Typically, the expectation is okay, they're going to do an internal exam. Now, it's not like when you go to the gynecologist, it's way friendlier than that. But because of our experience with gynecology, a lot of women are like, ooh, pelvic exam. But it's more a pelvic muscular exam. So when we do our muscle testing or screening, it's actually not very deep. And what we're trying to do is get a sense of, do you know what and where your pelvic floor is? Okay, can you engage it? How is your breathing when you engage it? Are you trying too hard? Are you actually contracting your pelvic floor or just clenching other areas of your body? You know, what about the strength of that area? You know, what about if are there any pain points? And then exercises to address that, you know, and even things like hip flexibility, core strength, we look at all of those things. I mean, it's really integrative because everything is connecting there. Sometimes I even look at nerve function, history of back pain, sacrum issues, you know, sometimes even like issues with people's feet because there's nerves in the pelvis that go to the feet as well. So we do like cover some very specific, unique things, but we also cover other systems too that will deal with your pelvic function, like breathing. We go over that a lot because of the diaphragm and how it relates to the pelvic floor. And I mean, depending on the kind of pelvic floor therapist you go to, the sessions typically and should be like one-on-one. So you're working with the same person the entire time, and typically it's like an hour session. It could involve more exercise, it could involve more education, it could involve like pelvic muscular treatment, or sometimes, I'm actually on the phone with doctors saying, hey, my client needs like a compounded medicine because it's going to help with their pain and vaginal injury. So it's a lot of it's very involved. Does that help give you like a better sense?
Yeah, thank you.
You're welcome.
I always say they get very up close and personal.
Yes. My patients say, well, you've seen everything about me already. So what else is there?
Jennifer, after cancer, it's kind of like whatever.
Yes, I have no concern with that whatsoever.
And honestly, it made me feel so much better that I didn't care. Like it was so beneficial to me. Because my issue is I had a lot of tightness. Because somebody made some comment like, oh, they're just teaching you how to do Kegels. I'm like, actually, no, they told me to never do a Kegel again in my life because I don't need anything tighter there. So it was about relaxing for me. A lot of it was. So it was, like I said, they're up close and personal, but it was so beneficial to me.
Did they use biofeedback with you? Some physical therapists are very into using biofeedback to help you visualize like what the heck's going on in your pelvic floor because we can't see it. It's something that's a little more abstract.
I did not, but I know another friend of mine who went to pelvic floor therapy. Hers wasn't cancer related. It was a different surgery she had, and they did biofeedback on her. I did mine at like my hospital. So it was she was really good, but it was more of a get them in, get them out type of, what I mean? Because it was a hospital setting, but she was incredible. She like, she could get a lot done in what they scheduled her time for. So, so I did not, but I know people who have, and she was really good and my insurance covered it. So that was even better.
Yeah. My OBGYN had said about the vaginal dilator, but it was kind of like, go home and Google it. It wasn't like find a pelvic floor therapist who does that. So is that,
or who could teach you how to use it? Or
I got taught how to use them.
Yeah.
I was taught how I was told which ones to buy, and then they taught me how to use them.
Yeah. Or maybe
I don't think I would have been. I don't think I would have been comfortable just buying them and saying, "Hey, let's see what happens," because there was like specific ways I should use it to help.
Or positions even, like say, with your shoulder. It's like you're not going to be able to assume the standard position for the dilator. We're going to have to come up with something unique to you to be able to use it and have it help you. Even like body mechanics too is a part of that training. Or, some of these devices, like I've had clients come in and they're like, yeah, I got a bunch of these. Like they told me to use them. Like, what are they? How am I supposed to do this? Like how many times a day? And how far do I need to go in this series? And it's really unique to every person. And oftentimes I will do device like education training, setup, so someone feels comfortable and doesn't, I don't want to say injure themselves, but just uses it the proper way to get the most benefit from it. Speaking of ergonomics, also sexual ergonomics too is something that can be done in pelvic physical therapy. In different kinds of supports and positions, things like that.
Yeah, just to the point that, the doctors kind of mention it, send you off or act surprised and, to send me home and be like, Google dilators. I'm like, And, and again, I do use this fruit salad thing and not just here, but I've referenced it with my husband. But I said, I felt like I was adding tongs to the fruit salad that I was already creating.
I mean,
And I'm like,
Very apt
I felt
metaphor.
very intimidated by this. So I'm glad to hear that that's in therapy. I could be, taught how to use it
You
more so
know,
than just Googling it. Yeah.
well, the thing
Thank
is,
you
a
for that.
lot of those companies will send me samples of their products, and there's so many different types. So maybe one brand is better for you than the other. Maybe the plastic one doesn't feel so good, and maybe you need like higher grade, like medical silicone. Maybe some people are like, what about glass? I don't want plastic or silicone. I know everyone has like a difference, or some people can't even tolerate the dilators, and there are other options like a wand, which is like much thinner, more approachable. Plus, it helps someone to actually see and feel these things versus like looking at it online, because yeah, it can look daunting. No,
Do you know anybody who had any success having health insurance cover the red light therapy wand? Or you're not familiar
no,
with that? No.
no. I mean, even some of the clinicians that I worked with in New York, like it's not covered. The only time like I- I've ever had it covered was a clinic who had a machine, and I would use it as part of the treatment and bill for it with specific wording to get it covered. That was
You
the
guys
only
can't
work.
use it like an HSA for that or something, you know?
Unless the website says you can use it for HSA.
Uh,
I don't
You
even
can
know
use
if,
HSA 100%. Anything that is be considered medical, you can
Yeah.
use your
uh-huh.
HSA for 100%.
Mm-hmm.
Hmm. Yeah,
I
and
use a red light therapy mask, and I think it's just the best thing ever. It's so relaxing and so great. So that's why I'm intrigued by that as well. I had never heard of that
so
before, but honestly, it might be worth it, $700 or
I
$800
is
if
the
it works.
mask like very small? Because I've had some patients that say the same thing, and I'm like, if
No,
you can put it
well,
just over the vulva,
I
it would have
wonder
the same
actually.
effect as over your face.
I
Yes.
kind of thought about that because the one that I has like a neck drape, if you will, and then the
Hmm.
mask. I don't know. My
Yeah.
husband says I look like, I don't know, some character from some movie, and it's not flattering.
Jennifer, you'll have
But
to try it now and get back to us. Let us
it's so relaxing.
know.
Yeah, I'm gonna have to be like, okay, face, vagina.
Now we're cooking the salad.
That's
Yeah.
it's like grilling romaine now. I was just not go there.
Yeah, but I mean, if it's like pretty malleable, like there's really, and if it works like on your face and you're getting good benefits, much like hyaluronic acid can be used above and below, it's more external rather than that red light wand. Like I've had male patients who are like, oh, I have a red light thing for my shoulder or like a blanket for my back. And I'm just like, wrap your pelvic floor and use it. So you'd give that a try.
well,
Let's see.
awesome. This was fun. Thank you so much.
Yeah, thank you for having me. No.
Awesome. I'll as long as I mean I'll stop recording, but if anybody has any